Welcome back to the channel. Today we're diving into the world of calcium, one of the most important minerals in our body. You know, we always hear about eating our veggies and getting enough protein, which is super important, but calcium often gets overlooked, and that's a big deal because this mighty mineral plays a role in so many essential functions that keep our bodies running smoothly. Let's explore why calcium is absolutely crucial for our overall health. When we think of calcium, the first thing that pops into our heads is strong bones and teeth. And for good reason. A whopping 99% of our body's calcium is stored in our bones and teeth, acting like the steel beams and concrete foundation of our skeletal system. This mineral is essential for building and maintaining bone density, making them strong and resilient. Without enough calcium, we increase our risk of developing bone diseases like osteoporosis, which makes bones weak and brittle, and rickets, which affects bone development in children. Ever wonder how our muscles contract and relax, allowing us to move, groove, and conquer our day? Calcium is a key player in this process. Think of it as the spark plug that ignites muscle contractions. When calcium levels are low, our muscles may struggle to contract properly, leading to those annoying and sometimes painful muscle cramps. So if you're hitting the gym or just want to move through your day with ease, make sure you're getting enough of this mighty mineral. Our nervous system is like a complex electrical grid, constantly sending signals throughout our body. And guess what? Calcium acts as the conductor, ensuring these signals are transmitted quickly and efficiently. Calcium ions help transmit these nerve impulses across nerve cells, allowing us to think, feel, and react to the world around us. It also plays a role in regulating nerve function, ensuring our nervous system stays balanced and responsive. Chapter 4. The beat goes on. Calcium for heart health. Our heart, the hardest working muscle in our body, relies heavily on calcium to keep a steady rhythm. Calcium helps regulate our heartbeat, ensuring it beats with the right force and rhythm to pump blood effectively, but it doesn't stop there. Calcium also plays a role in regulating blood pressure, keeping it within a healthy range, so a calcium-rich diet can contribute to a happy and healthy heart. Chapter 5. Rapid response, calcium for blood clotting. Ever get a cut and watch in amazement as your body works its magic to stop the bleeding? That's calcium in action. This mineral is an essential component of the blood clotting cascade, a complex process that helps our blood clot and prevents excessive bleeding when we get injured. Without enough calcium, our blood may take longer to clot, increasing the risk of complications from even minor cuts or injuries. Chapter 6. Hormonal harmony, calcium's role in regulation. Our endocrine system, responsible for producing and regulating hormones, relies on calcium for smooth operation. Calcium plays a crucial role in the secretion and regulation of various hormones, including insulin, which regulates blood sugar, and parathyroid hormone, which controls calcium levels in our blood. This intricate dance between calcium and hormones ensures our bodies function optimally. From the tiniest cells to our largest organs, calcium is essential for cell function and growth. It plays a vital role in cell division, allowing our bodies to repair and regenerate tissues. Calcium also activates certain enzymes, which are proteins that facilitate chemical reactions within our cells, keeping everything running smoothly. Without enough calcium, our cells wouldn't be able to function or grow properly. Not getting enough calcium can lead to a range of health problems. One of the most well-known is osteoporosis, characterized by weak and brittle bones. We also have hypercalcemia, a condition where calcium levels in the blood drop too low, leading to muscle cramps, spasms, and even seizures in severe cases. In children, calcium deficiency can cause rickets, affecting bone development, and in adults, it can lead to osteomalacia, softening the bones. Calcium and vitamin D are like best buddies when it comes to bone health. Vitamin D helps our bodies absorb calcium more effectively, ensuring we get the most out of this essential mineral. Without enough vitamin D, our bodies can't absorb calcium properly, which can lead to calcium deficiency and weakened bones, so make sure you're getting enough of both nutrients for optimal bone health. The good news is that getting enough calcium is easier than you might think. Dairy products like milk, cheese and yogurt are excellent sources, but if you're lactose intolerant or prefer plant-based options, no worries. Leafy green vegetables like kale, spinach and collard greens are packed with calcium. You can also find it in fortified foods like plant-based milk, orange juice and cereals. And don't forget about fish with edible bones like sardines and salmon, nuts, seeds and tofu. The amount of calcium we need varies depending on our age, sex and overall health. For adults, the recommended daily intake is around 1,000 to 1,200 milligrams. Growing children and teenagers need even more, while pregnant and breastfeeding women also have increased calcium needs. It's always a good idea to talk to your doctor to determine the right amount of calcium for you. If you struggle to get enough calcium through your diet, supplements can be a helpful option. Calcium supplements come in various forms, including calcium carbonate and calcium citrate. However, it's crucial to talk to your doctor before starting any supplements, as excessive calcium intake can lead to health problems like constipation and kidney stones. They can help you determine the right type and dosage for your needs. Calcium and weight loss, a potential ally. Some studies suggest that calcium might play a role in weight management. It's thought that calcium may help regulate appetite and increase metabolism. However, more research is needed to confirm these findings and determine the optimal calcium intake for weight loss. So, while increasing your calcium intake shouldn't be seen as a magic weight loss solution, it can be part of a healthy lifestyle. Chapter 14. Aging gracefully, calcium and bone health as we age. As we age, our bones naturally lose density, increasing the risk of osteoporosis and fractures. This is especially true for women after menopause due to hormonal changes. Ensuring adequate calcium intake throughout life, especially as we get older, is crucial for maintaining strong bones and reducing the risk of age-related bone loss. Chapter 15. Calcium and kidney stones, separating fact from fiction. There's a common misconception that consuming too much calcium causes kidney stones. While it's true that some kidney stones are made of calcium, dietary calcium is not the culprit. In fact, getting enough calcium from food sources may actually help prevent kidney stone formation. However, excessive calcium supplementation can increase the risk, so focus on getting calcium from your diet and talk to your doctor before taking supplements. Calcium, your body's best friend. Thanks for watching. Remember, getting the right amount of calcium is crucial for your overall health. From building strong bones and teeth to supporting muscle function, nerve transmission, and even heart health, this mighty mineral plays a vital role in keeping our bodies running smoothly. So make sure to fuel your body with calcium-rich foods and talk to your doctor about whether supplements are right for you. Don't forget to like, subscribe, and hit the bell icon for more health tips and information. Stay healthy and see you next time.